Good morning, everyone. So today I'm doing a complex breast revision, breast lift revision surgery. And my patient previously had a breast augmentation and breast lift with another surgeon, which resulted in a lot of complications and asymmetry. First, the other surgeon placed two very different size implants in the patient. So one side is significantly smaller than the other. Also on the smaller side, she removed almost 200 grams of breast tissue, so it was even smaller. Second, they made extremely large pockets, so both implants are falling out to the side. The space in between the implants is over 12 centimeters, and on the left side, it's bottomed out, meaning it's fallen underneath her actual breast crease. And finally, the breast lift was done very asymmetrically. One side sits significantly lower than the other. It's looser than the other side, larger than the other side, and the areola are too large and not circles. So for the surgery today, I'm going to remove her current mismatched implants, do a capsulorrhaphy, and fix the pocket using Stratus, meaning I'm going to move the implants closer together, fix the bottoming out, and reinforce the pocket with Stratus, which is acellular dermal matrix. And then I'm going to revise the lift so that way her areola and her breasts are symmetric. And incidentally, this patient is a former tummy tuck patient of mine, which looks perfect and beautiful. So I'm going to show the before and after of her tummy tuck really quickly before we start today's surgery. So I just wanted to show how large and lateral her pockets are. This is a ruler measuring 15 centimeters, and I can barely feel the edge of her implant. And you can see when I medialize her implants and put them where they're supposed to be and let go just how far to the side her implants are sitting. They're almost touching the bed. Just another view. See, this was her breast crease. The implant is under and lateral. Look, when I move the implant to a better place, it's supposed to be sitting here, and her implant's sitting all the way down and out. So I made an incision through the skin. You can see how thin it is over the capsule. In the previous surgery, the doctor removed a lot of breast tissue from the lower pole, and you can see it's just barely skin on implant. So putting the Stratus in is also going to protect the implant. And I just wanted to show how much they thinned out the lower pole. Look, it's literally just skin on implant. Super, super thin. And now I'm just very gently removing her old implant. It's small, it's 415. And you can see just how big and lateral the pocket is. So if you see where I put my pickup in the corner, I'm almost at the bed. They're falling all the way to the side. First, I'm going to repair the pocket by putting sutures in to make it smaller and also to medialize the implant into the right place. So I've used a double layer of sutures to close off the pocket. I've done that all the way around. So now the implant will sit more medially in the proper place and not in her armpit. So now I'm going to repair the pocket on the left side. And you can see this was her crease. Look where the implant is. It goes 5 centimeters beneath her crease. It's all the way, this is the edge of her breast. It goes all the way into the armpit. This is almost her back. Okay, so removing the implant from the other side, and this side is much larger. 505, and we'll show on the back table how different the implants are. You can see what a huge size difference there is here. Look at the diameter difference. This one is way bigger than the other side. So now I've repaired the pocket on the left, the really giant one. You can see this super neat suturing here. And I'm going to place the sizer in so you can see how I've now fixed the bottoming out and the crease. So I've repaired the pocket on this side, and you can see now when I place downward pressure on the sizer, her implant stays in the crease. Remember before it fell completely underneath and out to the side. Now I'm going to line each pocket with Stratus. And Stratus is acellular dermal matrix. It's made from dermis. And on the left side, it's going to secure the pocket and also provide an extra layer of protection because remember how thin it was. And on the other side, it's going to secure the pocket repair. So you can see when I open the incision, the Stratus is really beautifully lining the pocket. So for the permanent implant placement, the whole field has been prepped and draped. We've all changed our gloves. And now we're placing the implant in the sterile Keller Funnel. And then very gently placing the implant into the pocket. Great, thank you. So now I'm going to repair her areola on this side. I can't show it because of social media, but it measures 5.5 by 6, and it's very irregular, like the edges are all raggedy. So I'm going to use this cookie cutter and make it a perfect circle. And I'm just cutting a perfect circle. So I just wanted to show the final beautiful shape of the right side. And you can see how now I've made the areola a perfect circle, and I've also lifted it. And look where the implant's sitting, exactly in her crease. Beautiful final lifted shape. You can see her implant sits in the crease on both sides, and I've done the lift exactly symmetric, where the distance from the nipple to the crease, from the top of her chest to the nipple is exactly the same, and they're exactly the same from the middle. It looks perfect.